Hello, everyone. It's a day with your fertility specialist. Yes, it's Friday. Everyone loves weekend. Or most people love weekend. I'm sure there are some people that do not anticipate weekend. Yes, it's good to have you, our dear viewers, on this day with your fertility specialist on behalf of Alps Hospitals. We love to say a very big thank you to our dear viewers. Thank you for liking our post. Thank you for always staying glued to your screen. Yes, we appreciate you all for always joining. Right now, as we get started, call up someone. If you need to send data or send a message to someone to remind them, please do that right now because there's a lot to talk about. And yes, today's question and answers day. We have someone very amazing for someone that is also that's just watching for the first time that probably has not heard about him. There's just a lot about him. So he has your time, like you have him for now. So drop all your questions, whatever your concerns are, keep them rolling in the comment section and we'll definitely attend to them. And for the sake of someone watching, to answer your questions today, to clear your doubts today and to deal with your concerns today, we have Dr. Kenneth Iguda. Dr. Ken, it's good to have you.
It's a pleasure.
Yeah. For the sake of someone watching for the first time, because I know our viewers, most of you are used to him, but for the sake of someone watching for the first time, a little about Dr. Ken. Dr. Ken is a consultant gynecologist. He's a fertility specialist, an IVF specialist. As a matter of fact, one of the best that you think you ever can meet. Yes. If not in Africa, if not the world.
You want me to start fanning myself right now?
A lot. A lot, like so there's just a lot about Dr. Ken. Yes, I'm not even done. He's a minimal access surgeon. He's the one that pioneered laser gynecological surgeries in Africa. So you can imagine you have such a person to deal with your questions. Come on, what are those questions bothering you? Let's deal with them right now because you have the best person with you at the moment. So keep those questions, sit back and enjoy the show. Dr. Ken, once again, it's good to have you. So I know I know our viewers will have a good time. So we have some of their questions popping up. I know in the course of the week, yes, it's PCO Awareness Month, and we've had to talk a lot about PCOS. So we have some people too that have asked questions, but there are also some people too that have also asked questions outside the box. So we also
Okay.
have to deal with their questions. One of the questions that we have people one of the questions we had was someone asking, does contraceptive cause infertility? Maybe I'm just imagining, there are some people that will say they did family planning and after taking it out, they're struggling with conceiving after one or two. So I'm sure that's where this person is coming from now, asking if contraceptive actually cause infertility or if in a way it impedes fertility in a way.
Wow. Interesting question. But I think I'm going to answer it in two different ways.
Okay.
Contraception, there are some form of contraception that are permanent contraceptions.
Okay.
And when you have such kind of contraception or contraceptive services,
Yes.
it's automatic that you are infertile.
Mm.
So but then the individual knows this before going into it, and one of such is vasectomy.
Okay.
Once you have vasectomy, that's the vasectomy. It's a minimal, I mean, a minor surgical procedure where the conduit for sperms are cut, are
Okay.
blocked, so a man is not able to ejaculate
Oh.
or to bring out sperms.
Mm.
So technically, you've rendered him infertile.
Mm.
So he can't just voluntarily make a woman pregnant
Pregnant.
just by having intercourse. So
Mm.
if he has to make a woman pregnant, he has to do some surgical sperm extractions,
Oh wow.
and then the sperms can be used to fertilize a woman's egg. And so assisted reproduction technology, so she can
Yeah.
get pregnant. So that's for the man's side.
Mm.
Okay. So if a woman has a bilateral tubal ligation, for instance,
Mm.
she automatically rendered
Infertile.
infertile.
Okay.
Yes, let
Mm.
me use that word that way. It means she can't just get
Okay.
pregnant just casually.
Mm.
So, and she needs to understand this. But then it's possible to get pregnant, but with assisted reproduction technology.
Technology. Okay.
So you have to treat her, get her eggs, and get the
Mm.
husband or partner's sperms
Sperm.
or
Mm.
sperms from anywhere, and then fertilize the eggs and put it back
Mm.
through the vagina into the
Wow.
uterine cavity. So
Okay.
pregnancy is possible that way.
Mm.
But the other ones, the hormonal contraception, the non-hormonal contraceptions, and all of that.
Yeah.
They don't necessarily cause infertility,
Okay.
but some may delay your fertility, return
Oh.
of fertility,
Oh. Wow.
like
Okay.
the progesterone implants,
Okay.
either the one they bury under the skin in the arm,
Mm.
or somewhere. Those ones, sometimes part of the side effect is that
Oh.
return to fertility becomes maybe a challenge. So you
Wow.
need to see a reproductive gynecologist who
Mm.
will understand that
Understand
and
exactly.
help walk back your fertility.
Mm.
So that's the only one that would technically delay fertility. The
Fertility.
others, as soon as you stop them, you just get back to fertility
Fertility.
again.
Mm.
So yes, so some would, as side effects, make you have a delay,
Mm.
you know.
Yeah.
But then it's good to know that when you take contraception to,
Yes.
especially the hormonal contraception, to certain age, the age may be the reason why you're not getting
Oh.
pregnant,
Mm.
and not
Because
the
of the
contraception
contraception.
itself. So
Mm.
that is why you need somebody who understands the
All of
reproduction
that.
to interpret what's going on.
Mm. Okay, so this is someone asking. So hope that answers your question. Well, yes, you always have these outliers. There are some people that it could just be a reason for you not to return, but
Yeah.
it depends. Like he has said, it's individualized, and you can also, because it's happening to this person, that's the reason why it's happening to you as well. So I hope that clarifies your concern. And if you have other concern, you could actually have an online consultation, or you could see a specialist like Dr. Ken, or those that we have at House Hospital, and you will have a good clarification on that. Okay, so we have someone asking, I think this is Anu Gold from TikTok. She said, what the person is asking with regards to embryo transfer, please, doctor, can I travel 5 days after my embryo transfer? Oh, that's strange. And coming. Well, I know people have their concerns, but this is someone just asking randomly. Probably she probably had an embryo transfer not too long ago, and she's asking this question.
You know, you can travel, after embryo transfer,
Mm.
and then you still get pregnant.
So it's not.
Yes, you can do all kinds of travels. Travel by land, travel by air, or by sea
See,
or ocean, and still
whichever.
get pregnant. As a matter of fact, you can travel the next day
Mm.
after embryo. In fact, we've done an embryo transfer for women who travel the same day
Wow.
out of the country. Yeah,
Wow.
because they had to go back to their
Back.
station. And some of
Mm.
them traveling to England, or one of the European countries. We've
Yeah.
had people travel as far as going to the States, US,
Wow. Wow.
and some got pregnant.
Pregnant.
So if you don't get pregnant, it's not because you traveled.
Traveled. Mm.
Yes, it's
So
something else.
that's a
Because
misconception.
exactly,
Mm.
it's just not because women have a lot going on in their heads and in their
True.
minds, and they read a lot, and some
Mm.
of the things they read are junk.
Mm.
I could even remember that a woman once did embryo transfer for, and she refused to come down from the operating table.
Wow.
Yeah, she refused to come down.
Hmm.
I was like, madam, come down. She said, no, she's not coming down.
Oh, wow.
Of
That's
course, it's
serious.
funny. Some of us are laughing,
Mm.
and she said, "Now, how can she come down?
Mm.
Like, if she comes down, the embryos would drop off.
Oh, no.
We have to start explaining to
To
her
her.
this cervix has a valve that
No.
keeps things inside. Things don't just come out that
Like
way."
that.
And then she now came down from the operating table and refused to walk.
Oh, my goodness.
You
Wow.
know, when we managed to force her to walk, she was walking with crisscrossing her
Oh,
legs,
my.
as in
Wow.
closing
Yeah, yeah,
closing up on the
yeah.
perineum,
Wow. Oh, my goodness.
feeling that the embryos would drop when she
Oh,
stands.
oh, no.
So women have actually thought of
A
worse
lot.
things than traveling.
Yes,
So you can
can
imagine.
imagine. Mm.
So it's
So
all
Anu
of that.
Gold, please, you can
Just live your
travel.
normal life after these.
Mhm.
Just avoid unnecessary stress. After embryo transfer, in fact, it's not even advisable to go and lie in bed for 2 weeks, as some people do.
Mm.
You know,
And they start
because
having back.
yes, they have backache and they have a poor blood flow, because they
Mm.
are they are they are
They are
static.
restricting themselves.
And that is negative to the success of IVF.
Wow. So
So
hope you
just
are
live
learning
normal
that.
life.
Mm.
Have fun if you want to have fun. Relax. listen
and
to
be happy.
music, watch football,
When you say listen
or
to music,
listen to political news.
you appear to be someone that loves music.
I do.
Oh, okay. So we have, I think, okay, this person is asking, so I have azoospermia. Can I do IVF? Well, maybe you could say a little because this person might be able to understand what they are referring to as azoospermia, but somebody might be
Okay,
wondering
so
what that is.
azoospermia just means there is no sperm
Okay.
in the ejaculate.
Okay.
That's azoospermia.
Okay.
So now, if you have azoospermia, technically it means you can't make a woman pregnant by
Pregnant.
intercourse,
Mm.
because what comes out of the ejaculatory fluid has no sperm cells in it.
Yeah.
You know, so it's technically impossible to make a woman pregnant by just having sex.
Mm.
So, but then azoospermia are considered are different. There are different types of azoospermia. There's the functional azoospermia where the body does not produce sperms at all. And there is one that is obstructive. The body produces sperm, but the conduit for the outflow of sperm is blocked.
Yes.
So sperms can't come out. So, but then there are sperms in the stores, in the epididymis. So, in this situation now, you could have a surgical extraction of sperms from the store
Oh,
and use it to
okay.
fertilize a woman's egg.
Okay.
Yeah. So it
It
depends on the type of
depends.
azoospermia. But then if you succeed in making someone pregnant, you should have some form of sperms. Then you have a surgical extraction of sperms for IVF.
Okay, so it depends. So for this person that asked this question, maybe just maybe if you seem to need more clarification, you could actually we could talk via a DM or you could book an online consultation with the number being displayed on the screen. So we can also understand because he had let us know that it depends on the azoospermia too. And
Some guys actually have this information, but they don't know how far to take the information. So I think just today I even saw someone with azoospermia. Yeah, azoospermia, and in this case, you need to be evaluated by the doctor and even see whether
yes.
surgical extraction is going to be possible. Some people have azoospermia with I'm looking for words to use that would be clear. The testicles are shrunken, you know.
Yes.
So you need to be evaluated by the doctor to see whether even the testicles are viable.
Oh,
And some testicles, testicles has a size.
yeah.
So first of all, the doctor will need to check whether you have testicles,
That's
and
another
then if you
one.
have testicles, whether they are the appropriate sizes.
Yeah.
If they are the appropriate sizes, whether there are things that are making sperms not to be formed. Your health status, generally diabetes, hypertension,
That's
thyroid abnormalities, will all be checked. You know,
it's a lot.
there's a lot. So to establish whether you have stores, and of
Yeah.
course the hormone profile of the man too, because there is a pattern of hormone that shows the body doesn't produce sperms, and there is a pattern that shows your body produces but it's not coming out.
Coming out.
And so if this is established, then of course the doctors will be able to decide this one should have a testicular aspiration or testicular extraction, or should go for sperm donation outrightly.
So I like I was saying, for you that asked this question, I believe that we're not very sure if you have so much in-depth knowledge of the azoospermia you're dealing with, but maybe just maybe you would actually need to do further evaluations so you know where you stand and how to go about things going forward. So I hope you've actually gotten a good clarification on that. So this is someone asking, what is the age limit for IVF? She said she's 59. Oh,
Oops.
that's
Oh dear.
okay.
So now, if I want to answer scientifically, I'll say there's no age limit so long as you are healthy and you are judged by your doctor or the medical team who sees you and feels you are capable of being pregnant, get pregnant. So, but then there are women who are 20 years and are not fit to be pregnant. So it's not all about age.
Yeah.
It's not all about age. It's about health. If you're healthy, even at 59, you could
Stand the chance.
stand the chance of being pregnant. Because we had a 63,
Yeah.
that made a whole of ripples around this part of the globe and all of that.
Yes.
But then you have to also look at the society you live. the laws controlling reproduction in the society.
It's true.
So it should be tailored to the laws of the land.
Hmm.
If there is a law that says certain age should not have fertility treatment, then you don't go
Go beyond
against
that.
the law.
Hmm.
Yes, that's the way I see
So
it.
hope that answers your question. So the question now is, are you healthy? For you
Exactly.
that is asking this
Exactly.
question.
Yeah.
Well,
Because
we
when we had the 63-year-old who got pregnant,
yeah.
at that point there were no regulations, you
Hmm.
know, but then she was very healthy. She
Hmm.
had no problems throughout the
Wow.
pregnancy.
Wow.
Throughout,
It's
she had no
amazing.
problem. Antenatal period was very
Smooth.
smooth.
Wow.
Antenatal period was very smooth. And the baby, I saw the baby some days ago. I mean,
Hmm.
a month ago, because the
Hmm.
baby was insured. Yes,
Hmm.
I don't want to talk about the story how the insurance came, because
Wow.
some of my friends in England, called and were like, "Hey, Ken, we heard your team made a woman 63 years
Being
plus
pregnant.
pregnant. What's the life expectancy
Oh
of
my
life in
goodness.
Africa that you
Hmm.
have to make a 63-year woman?" And that got to me morally.
Hmm.
Yes. So, and of course, they were so blunt that, what happens
I can imagine.
based on life expectancy? Okay, we say, okay,
Hmm.
fine. For the sake of that, we took responsibility
Wow.
and
That's so thoughtful.
insured the baby,
Hmm.
educational insurance, and all of
Wow.
that, just
Wow.
in case,
Hmm.
But it's just what it is.
Yeah.
Yeah, yeah, just what
Because
it is.
after all, she's fine
She's fine. Yeah, I
and
saw her
everything.
just a month ago, and
Wow. They're all doing great.
yeah, they came to visit.
That's
Mhm.
a big plus. Okay. So I hope that answers your question. So the question is, are you healthy? Well, you wouldn't decide that. You would have to be evaluated
Yeah,
for you to decide that you're
and of
healthy
course, it
and
depends on the region of the world she's asking the question from.
from.
We're beginning to have regulations in Nigeria. In
Mm.
Lagos State, for instance, it's not permitted to do an IVF when you're more than 52 years.
Wow.
Yes. When I was in England, University of Warwick, Center for Human Reproduction,
Yeah.
our cutoff then was 50.
Okay.
Yes, 50.
Mm.
I don't know if it has gone low now, or
Oh,
but
oh,
that was 50.
oh.
But even then, it has to be with egg donation.
Mm.
Yeah.
Because I think I have that question. She said, please, I'm approaching 49 this year. What is the possibility of using my egg to be pregnant and having safe babies free from abnormalities? Oh,
you
this
know,
is
you know,
this is combining two.
this morning, yeah, it was a very busy day, so had a lot of surgeries,
Mm.
and I was just thinking of aging
Mm.
and the battles that women go
Going
through
through.
because of egg donation.
Yeah.
And I was just wondering if we could genetically modify the reproductive life of
Of
women
women
to make them have an extended, uh,
lifespan with
yes,
their
yes,
fertility.
fertility lifespan, and vis-a-vis egg production till
Mm.
they are
Certain age.
50,
Mm.
50, all of this. Because a lot of women come to get pregnant at that point, and then they have battles accepting egg donation, which is where
Donation.
this body, I mean, talking
Personalized.
about.
Yes.
So when you are at that age, the chances are that it's egg donation, because with the current possibility with the
Mm.
human body at 46, you only have 1% chance
Mm.
of getting pregnant with your egg.
Wow. Wow.
Yes, just 1% at 46.
Mm.
At 37 years for a woman, just 30% of the egg she has left may be in good condition.
Donation.
And that is why you see, you do an IVF procedure for a woman 37 years, she produces few eggs, and most of the eggs are not in good
Poor.
condition. And pregnancy chances are reduced.
Yeah.
So now you're looking at 49.
Mm.
At 49, chances are that she has actually no eggs. Yes. Even if she has, they may not be in good condition, because uh, the ovarian apoptosis index is high. A lot of abnormalities with
The
egg at that
egg.
point in time.
Mm.
So most fertility specialists will tell you outrightly you want to have egg donation. But then if egg donation is not acceptable by you, then the more ovarian rejuvenation using
Mm.
stem cells, platelet rich plasma,
Yeah.
adipocytes, and all of
All of
that
that.
should be the only option with
Mm.
current scientific possibilities now, except of course if the part of the ovaries have been taken before and cryopreserved, then you can put it back, and then she gets to whatever age she wants to get to,
Wow.
producing her own eggs. These are all possibilities, but given what's available right now that is readily accessible, egg donation is the option that she likely has.
So I hope, I know that your guess is as good as mine, and I know you can understand from what he has explained the best options open to you. However, it's still left for you to take the decision, and we hope that you take what's the decision best for you and you're able to achieve your fertility dreams soon. So yes, we're back to the PCOS people. She said, I'm from Uganda. I'm 35 years, but I have PCOS and I do miss my period. Please, I need your help. Well, I'm sure she just wants to ask, what do I do or how does she go about things? Apparently, she does not see her period regularly, or maybe she's trying to achieve pregnancy. So this is just more like saying, maybe what would you have to say about, and what do you have to tell her? Yes, which what she just
Oh,
mentioned.
well, the question is not specific,
Yeah.
because those with PCO have different problems, and the help you give them depends on what
What
their problems
symptoms?
are. If I was a woman, or I'm a woman and I have PCO and I'm not seeing menses, I think I'm going to be happy.
That's okay. You're back again.
If it's just
Well,
not seeing the
menses,
menses, I would
sure.
just be okay. But it doesn't stop there. You know, if you don't see menses, it means you're not ovulating, you can't get pregnant. So if it is pregnancy we're looking at here, we would have to evaluate how for why pregnancy is not happening. So it may be hormone abnormalities, the grade of the PCO, because we have 4 grades: phenotype A, phenotype B, C, and D, and see what level of PCO she does have, and decide how to help her. We could do ovarian drilling, which is the most advanced treatment for PCO. It helps with menses to return. It helps improve fertility. It helps improve ovulation and retention of pregnancy. So it's one that helps with a lot of things, because series of have had ovarian drilling following, because of PCO. Some of them not ready to really get pregnant and all of that, but menses have become regular profile. You see some alterations, some changes in the positive direction happening with it. So that's it. Then, well, there's an aspect that the PCOS that they are disposed to having endometrial cancer because they have prolonged, continuous exposure to estrogen. And so they are at risk of having endometrial cancer. So it is advised that if in 4 months period you haven't seen your menses, you should have an induction of menses, so you just bleed. That reduces the risks of endometrial cancer. So if she's listening, she will fall in one of those categories of problems. So, and based on who she's seeing, if she's seen a reproductive endocrinologist as a gynecologist, then I think she's better off.
When you said if you're a woman, you don't see your period, you'll be happy.
Yes, now I will be happy because
You reminded me
all the
of.
women I see that have periods are not happy.
You reminded me of when I was coming up as a young girl. When I was a teenager, then just maybe going to SS1, and I think I had attained MENA. After some time, I didn't see my period, and my parents were worried to the sky. And me, as the child, I was happy
Exactly.
because I felt like it was stress. So, but then, as parents, I think they were worried just to why will our young daughter?
I think women have been wired that what makes them normal is when they see period monthly. In a way, yes, but it's a big stress having to deal with periods. So I'm just saying that I feel if I'm a woman and the period's not coming, I just relax. I just relax, because period actually is one of my professors then in Oxford, the University of Oxford, was like, the period, menses menstruation is the root of all evil. That when a woman sees period, it's a problem. When it comes scanty, it's a problem. If it's excessive, it's a problem. When it does not come, it's a problem. So why is it causing all of this problem?
Well, yes, it's just, I think most women,
When it come, when it shouldn't be coming, it's
it's
a
a
problem.
problem. Well, I
Oh
think I
boy,
think
the life
people
of a
most,
woman.
yes, I think women are just wired that way, I guess. But it becomes more worrisome when I think they are probably in their reproductive age and they are thinking of pregnancy and they are not seeing it happening. Then the worry
And you
when you
get to
don't
a
see
point
the
you're,
period
you're you're hoping the period doesn't even come.
come.
And when
That's
you come, you
another
just
one.
go to the gynecologist.
Oh
So,
God.
doctor, I just saw my period.
Oh
I say, yeah,
God.
you should see it.
And you don't feel like
Pregnant.
that's true. Those people who for pregnancy, they always hope that I wish this would turn out to be pregnancy and period doesn't
Yeah.
come. So it's
But then I've seen a PCO lady
mm,
who never sees period,
wow.
but she gets pregnant.
Hmm.
I'm telling you the truth.
Wow.
She does not see period, but she has 4 kids as we speak.
Wow.
How that
She's
happened is, so
lucky.
there's a lot about the human body that we are still
Body
yet to understand.
understand. Wow.
That's just a true outlier.
Hmm. Yeah.
No period, but you're getting pregnant.
Pregnant. Wow. She needs to come and lay hands on others.
Oh yeah.
Okay, so this is someone taking us to laser vaginal rejuvenation. She's asking, do I still need to do laser vaginal rejuvenation after a cesarean section? Well, we have a lot of questions coming outside the box today.
Yes, you see, delivery itself, pregnancy itself
Yeah.
causes laxity of all the parts of the reproductive system.
System. Okay.
Even when you do not have vaginal delivery, it doesn't mean the vagina has been is spared. Although it's worse when you have a baby. You know the size of a baby's head? It's about 10 centimeters. A normal baby's head, the diameter, so the
Yeah.
circumference is about 10 centimeters. Me going through a birth canal that on a normal day is just about 3 to 4
Oh
centimeters
God.
wide. So it
Trauma.
tears down the muscle matrices. And sometimes some women don't even survive the tears. And to make it easy for some other women, the gynecologist or the attendant accoucheur
Yeah.
gives a cut to expand the place. Those ones, it is recommended that they have laser vaginal rejuvenation. Cesarean section is okay to have laser vaginal rejuvenation, even it's a session, because it just
Helps to return
rejuvenates the entire
function.
vaginal canal, vaginal wall. And functions are okay, they are better, they are improved, good blood supply, and good collagen deposition and all of that. So it's fine to have it.
Okay, so hope that answers your
It's fine to have
question.
it.
Yes, it's not out of place. I'm sure you would also, for someone that has maybe had the cesarean section, I'm sure you know that it's never it's same, like whether it's a cesarean section or vagina, you would actually need this to still restore function.
I'm also
And then
knowing
whether
that
or
it is
not,
not surgery. It's not
yeah,
surgery, So
exactly.
it's basically like doing an ultrasound scan through the vagina.
Yes. And then even coming to think of it, even if it's cesarean section, if you decide not to do it, age will still catch up.
Exactly.
And then
So you have a
you
lot
still
of reasons
exactly
why you will need
to
it.
still
Yeah.
tend towards doing it. So it's not out of place at all. Okay. So viewers, a lot of questions are coming, and yes, we might not be able to take all questions, but as your questions keep coming, we'll attend to them through a private chat. And if you're not satisfied, you could book an online consultation and you would have your questions answered. You would have all your doubts sorted out and clarified. But right now, we'll just take the last question. Well, this is another person asking, is it low air quality that causes recurrent miscarriage? She's 40. So this is her asking that question.
If you read the conventional gynecological books or
Yes.
obstetric books, low air quality is not talked about in it.
Okay.
Cause of recurrent miscarriages could be hormonal problems, things like PCO, thyroid diseases, diabetes, and structural problems with the uterus, maybe
Yes.
cervical insufficiency, maybe congenital uterine malformations.
Yeah.
These are common causes. But then poor egg quality is a big
Major
cause when you
factor.
go to assisted reproduction technology
Production.
or reproductive medicine. Because you see, when the eggs are poor, it means the
Yes.
chromosomes are not likely to be healthy.
Hmm.
They can get fertilized only to be aborted. So
Hmm.
it is a big and major cause of
Miscarriages
recurrent miscarriages when a woman is advancing age.
in
And now,
age.
advancement in age is not necessarily the chronological age,
Age.
it
Hmm.
could be the biological age.
Hmm.
A woman at 20, at 25 or 29, for instance, with extremely low ovarian reserve
Hmm.
may also have poor egg qualities
Quality.
with recurrent miscarriages.
Miscarriage. Wow.
So that's why when you're looking at care for people with recurrent miscarriages,
Yeah.
you have to look at the reproductive hormones
Hmm.
and you have to look at the sperms. Now, the sperm is also a cause of recurrent
Miscarriage.
miscarriages.
Wow.
Yes, the sperm is a cause of, in fact, the current evidence are suggestive that if a woman has a recurrent miscarriages, look at the sperms first. Because the sperms are so bad these days
Hmm.
that that they're responsible for most number of the miscarriages that
Miscarriage.
people
Wow.
have.
Wow.
So you could see it's just a lot. So, but you can't necessarily tell until you evaluate the people
And
based
all
on their
that.
own peculiar circumstances. Then you can tell what the cause of recurrent. But
Miscarriage.
age is a cause of
Mm,
recurrent
miscarriage.
miscarriage. Sure.
So hope that answers your questions. Yes, viewers, like I said, if we said we want to keep talking about answering your questions, yes, this live session is never going to end. But at this point, we'll have to end it right here. While Dr. Ken would just say one or two to people who listening out there right now. What's your counsel to them with regards to fertility as a whole, their lifestyle, people trying to conceive? How long should they keep trying? Should they keep trying till Jesus comes, or
Until the world ends, you
till the
mean?
word ends? Yes.
Is the
So
world going to end? Ruth, is
well,
it going to end?
we don't know. Well, we don't know. I think they said it was going to end sometime this month. So, but
Oh,
well,
really?
September has not ended. So September has not ended. So let's be preparing.
I don't want it to end. What did you ask again?
That's okay.
I've forgotten. Sorry.
Okay, yes, I was saying your general counsel, and I was saying people trying, should they keep trying? What's the general counsel to our viewers with regards to fertility, how to maintain their fertility, or people trying to conceive, how long should they keep trying, and all of that? Yes, just the general counsel.
All right. I just think what the counsel would be is once you try conceiving and it's not happening, just see a doctor.
Mm,
Yeah, I prefer to say this on a social platform, even though this is not the pure gynecological training or teaching. In gynecology, they say when a woman tries for 1 year, there are people that don't have the luxury of trying
looking
for
for
one
one
year
year. It's true.
because you have to put the age in perspective, ovarian reserve in perspective,
Yeah.
And some people go to see the gynecologist and gynecologist turns them back. See, you
Mm,
just got married, get back home, go and be having
try.
sex or something.
Mm,
And then you don't know that these people have brought themselves for you to explore and
mm,
understand what their peculiarities are.
mm,
You know,
mm.
so I think that whenever anybody presents to you with difficulty to get pregnant, you should take them and start treating them from that point in time.
Time.
And the same way, if a couple or anyone trying to get pregnant tries, even if it is once you tried and you feel uncomfortable not getting pregnant
Yeah.
and you feel worried, it's time to see the doctor
Mm.
and let them run all investigations and assure you that things are okay. Go and keep trying.
Trying.
Then you go and relax to keep trying, as against going to stay. I mean, just staying and not knowing
Yes.
that ovarian reserve is just going down very rapidly.
Hmm. You
So
know,
that's the way I think. That's my advice.
just before we wrap up, now you were talking about people saying gynecologists are no, and then they tell them to stop go and be trying.
Mm.
Recently, I think someone talked with me, and I think they saw a gynecologist probably, and they told her that she was not ovulating. And what the funny thing was, uh, wanting to know what was done, nothing really was done. They just said, okay, her husband has a low sperm count, according to what she said, and she was not ovulating. And from her own end, they left her with nothing, like no intervention, nothing really to say, okay, this is what can be done to help. They just placed her husband on supplements, and then maybe they left her to still
Go
keep
and be
trying.
trying.
And
Yeah.
I'm like, no solution really. They just left you like that. It's really worrisome sometimes when some of these people seek help.
Yeah.
So viewers, if you're seeking help, make sure you seek help from the right place, because I really cannot understand how you seek help and then you are not even understanding. Is it that they are not preferring counsel or something that needs to be done? Go to the right place, see the right physician or see the right specialist, so you don't keep wasting time and then you are hoping and nothing is happening. And then eventually when you are seeing the right doctor, it seems like you've wasted a
Yeah,
lot
yeah.
of time,
Mm-hmm.
a lot of resources in the wrong place.
Mm-hmm.
And that's why, make sure, I know that a lot of people are watching right now. Make sure you seek help from the right source, a right source like you could have at Alps Hospital. I'm not saying it's just Alps
You
Hospital,
know,
but
every day you learn from even patients, you learn from clients.
yeah.
There's a client I learned from. I mean, she challenged my mind,
Okay.
and I was very impressed. We had seen her, she's a bit advanced in age,
Okay.
in her late 30s,
Yeah.
and then we needed to do an IVF.
Okay.
You know, even though the subfertility has been because of male factor, sperm
Okay.
abnormality. So now she's going to have fibroid surgery, you know, and then she's going to have hysteroscopy afterwards
Okay.
before IVF is done. So this was our plan, I mean our action plan for her.
Yeah.
And she told me that, doctor, is there no way you could stimulate me and get my eggs out before
Before.
the fibroid surgery? I said,
Wow.
come on, man,
Wow. Wow.
where's she coming from?
She's a deep thinker.
Exactly. Because you see, if you do that, you have saved her some quality of
That's
eggs.
true.
If at all
That's
she still
true.
had egg at that point in
Yes.
time.
Yes.
Because
True.
by the time you wait until she had fibroid surgeries, then she recovered from fibroid surgery, and you have a post myomectomy hysteroscopy,
And all of that.
you will have taken close to 6 months.
That's true.
And in 6 months, a woman would have lost good number of eggs, and the eggs she's losing now are better
Better
quality than the one you will get
that
during
time
that IVF period.
period.
I suddenly just became happy with this woman. I was like,
Wow.
she has been trained by a gynecologist like us before, you know, save the days, save the eggs, and use it
Yes.
later.
Yes.
So women should be dynamic, you know, should be really dynamic and push their gynecologists to take good decisions
Yes.
for them. So I
Yeah.
was very happy. So, you know, that was a way to think. And as soon as
Yes.
she mentioned it, something in me resonates in agreement. I said, man, this is the way to go.
That's right.
Yeah.
So nothing says that you also cannot suggest to your doctor, but make sure you have the right knowledge and not be suggesting the wrong thing just in case you're not agree. Well, yes, this will be all for now, dear viewers. It's been good having you guys engage us this afternoon, and I know you had a good time. We look forward to seeing you in our next live session and even more of you. Have a lovely evening. It was good to have you, Dr. Ken. We had a good
Thank
time.
you.
Thank
Thank
you.
you.
So bye for now.